Thank you so much for inviting me to participate in this important symposium. Thank you for all the speakers, for their knowledge and their passion. I enjoy our meditation break, and today I am going to talk about how did we respond in the US in our academic medical center integrative health program. So I am speaking to you as a representative of the academic consortium of integrative medicine and health. We have 75 institutions who have an integrative health program, and this is on their behalf. So I'm also hoping to find you all well and healthy, and my heart goes to all of you. And here we go. The situation in the US is rather serious. As you know, we are going in the wrong direction. We have not been willing to learn from our colleagues from around the world, and our curve continue to go in the wrong direction. At the end of March, we sent a survey to all our members to see how they were dealing with the situations. Because as you know, at the end of March, we had to close all integrative health medicine program within the States. So our clinicians find themselves without the ability to see patients, but also the patients were not able to access care. So we look at what would be the opportunities and how could we deal with the situation. And consistently, we heard from our 75 centers saying that we had to do telehealth and start to see patients virtually. We also had an opportunity to increase our relevance by focusing on well-being, and especially on the well-being of our healthcare employees. And then it became really obvious that building a community and being together despite the challenges was very important. So,
Dr. Ann, I'm sorry, apologize. Could you please put the screen complete in the mode of presentation?
Sorry, say that again.
We are seeing the PowerPoint slides, but we are not seeing the presentation.
Meaning you don't see me, or?
Yes, we see you and we see your screen, just that we don't see the full slide, the full presentation way.
You know, I have the same things with everybody else speakers, by the way. And
maybe there is one option, and if you let to share the screen and then come back to share the screen, they show you different options, and you choose the first one that tells the screen. Usually with that word. Oh, that was perfect. Now it's perfect. Thank you.
Thank you again for your patience. So we in the States did until recently really telehealth, meaning seeing patients virtually, was an exception because lack of technology, because neither clinicians or patients were used to it. And more important, most of our insurance didn't pay for it. So we really had to very quickly reinvent ourselves and making sure that we were able to deliver this type of services. It was great to see again this element of community, to see that nationally and at the state level, insurance kind of let their rules to be less restricted, and were allowing us then to bill for telehealth for virtual visits. Obviously, it increased the accessibility for patients, including patients who live far away. It's convenient, it's practical, it saves time, and this is something that we will continue after COVID. Next slide. So we are offering, oh, no, sorry, we need to go back. One slide. Yeah, here we go. And maybe I'm able to control it. So we did telehealth not only for the consultation with the physicians and also psychologists, but our acupressure or the acupuncture team started to do acupressure. We did physical therapy through virtual session, or massage therapists did taught people to do a self-massage, or art, music, and dance therapy were available also virtually, and then some support through health coaching. We also made available group medical visits, and then offered a vast area of classes, especially important to deal with the stress and build resilience. So we talk about meditation, mindfulness, yoga, qigong, tai chi, with acupressure, self-massage, and a lot of workshops and webinars on lifestyle, nutrition, and wellness education. It's not easy to transition. You know, we saw the challenge of technology, and certainly we all experienced that. So initially, we even did things over the phone or using Facebook or Zoom, just, you know, whatever kind of technology worked, that's how we reach our patients. And it was then important to really make sure that we are working with what works in our own health system, and there is no standard yet of, you know, what is the technology to use. I mentioned that we had to figure out a way to bill for our services and work with insurances to make sure that we were able to bill for services. And then we had to, you know, make sure that how do we reach our patients who, you know, were in home shelters, as well as our providers, and making sure that through phone calls and emails and social media, we were able to reach out our patients. So lesson learned, it certainly took a while, and we are still learning from it. We had to train our administrative team, or receptionists, or nurses, or medical assistants, and of course the clinicians on how to use this. But we also had, as we saw today, and me in particular, how we had to be patient with our, oh, I don't know what happened here, with, are you still seeing the slide, or for some reason something jumped? You still see it? Did I lose you?
Now it's in the PowerPoint I think Kayo is working on that.
I hear you, I see my slide. Are you hearing me, and do you see my slide?
But you can continue.
Okay.
While,
okay.
Don't worry.
So again, we had to learn lessons. We talk about technology. We had to make sure that we build some privacy. And initially, we had patients literally calling them from their car, from their bathroom, because they wanted to have some privacy and not calling from home with their kids or their family members. So the whole thing took a while, but it guaranteed that we were able to continue to serve our patients, and we are grateful for that. It certainly was easier to see ongoing patients than new patients, but the learning curve has been, frankly, exponential. And at this point, in many centers, telehealth is almost becoming 50% of what we do. I add some testimonial. One patient say, I loved it. My provider was on time and I didn't have to drive to an appointment. Despite some technical challenges, we found ways to communicate. My provider was completely present and follow up with a summary and practical tips and additional links. I'm sold. From a provider point of view, it was also well received, and overall, it's something that will continue. I'm putting here a slide that I think that is so relevant, and as we see it today with people from all over the world. Natalia, I love your background and the map of the world behind you, showing how we, despite separation, we are all connected. So the quote say, the pandemic has shown us that separation is an illusion. We are connected to one another integrally and to the planet. And we need to move that awareness to the front of the line in all areas of social design, with opportunity for the health field and integrative health in particular to lead the conversation. We have been saying we don't like the word social distancing. We insist on using physical distancing and social solidarity. So I talk about another opportunity, and the other opportunity for integrative health in the US to increase our relevance is to make sure we are taking care of our employees, our colleagues. The rate of burnout in the US is about 50% for physicians and nurses. And this was before COVID. Adding the additional stressors, the trauma, the secondary post-traumatic stress disorder, the real fear and stress that we all have gone and experienced, it's more important than never to make sure that we are helping each other and focusing on a program to help employee well-being. What people are concerned most is, of course, the lack of equipment, the lack of support and staff, the learning curve that's been really exponential, and then challenge between childcare, transportation, and fear of contaminating their family. So we created a lot of programs for our employees, particularly in my institution. I'm in Ohio, in Cleveland. We developed a call center that is available for anybody to call to ask for support or tools or techniques. We have day and evening, weekend included, webinar and classes that are free. We have a crisis intervention team to support people during trauma. We ask constantly what they need. People receive daily email of encouragement and support. And we have created relaxation room, we call them lavender room, across the system. Again, this is a testimonial of one of our employees. Thank you for your creativity and innovation during those unprecedented times. I never tried self-massage, acupressure, or qigong before, and I enjoy learning these new things. I have also taken advantage of the meditation on many occasions. When everything in the world was crazy, the offering helped me to feel more centered and calm. I think this is important because for us, in the US, integrative health is certainly not yet well accepted or as accepted as we would like. It is accepted by our patients, but not always by the conventional, traditional healthcare system. So to know that we have made a difference by helping them has really changed the conversation, and I think is going to accelerate transformation and acceptance. Again, I think that Natalia and others who have made this symposium a reality know how important it is to celebrate community and how we are all in this together. And we certainly are stressing on that as well. We have actually a lot of support from the community, from businesses and services who are offering to help. We have built an appreciation board and we celebrate each other constantly. We are taking advantage of this crisis as much as we can, again, to make sure we become more relevant and increase solidarity and a sense of community. So that's all I have for you. I apologize for the technical challenges. And you can see this is my haircut before COVID, and now pretty soon I'll be able to have a ponytail. So, and again, I'm so thrilled and honored to be with you this morning or at night with our colleague from China. I have learned so much already, and thank you to everyone. Be well.